Hey lads, welcome back to the channel. Today I'm diving into a topic that's crucial for men's health, erectile dysfunction, or ED for short. So how common is ED? Well, it turns out it's more prevalent than you might think. A recent group of researchers wanted to get to the bottom of this, and they examined a host of studies to find out. But first, what exactly is ED? It's the inability to produce or maintain an erection firm enough for sexual intercourse. Now, ED can sometimes signal an underlying health issue like high blood pressure or obesity. Other times, it's driven by psychological factors. But how widespread is this condition? That's been tricky to pin down because the definition itself is quite subjective. Recently, researchers published their findings in the journal BJU International. They discovered that ED is indeed a growing concern. For instance, in the United States, annual spending on ED treatments jumped from $185 million in 1994 to a whopping $330 million in 2000. Why the increase? Well, age is one factor, and conditions like obesity and diabetes, which are also on the rise, play a role too. To get a clearer picture, the scientists reviewed data from 41 studies examining ED prevalence and its links to other conditions. The results were all over the place, with prevalence rates ranging from just 3% to 76.5%. Why such variation? It boils down to the different methods used to measure ED. For instance, the International Index of Erectile Function found prevalence rates between 13.1% and 71.2%. Meanwhile, another common tool created for the Massachusetts Male Aging Study showed rates from 15.5% to 69.2%. Less common methods produced the widest range, from 3% to 76.5%. Geographically, the data varied as well. Europe showed a range from 10% to 76.5%, Asia from 8% to 71.2%, and so on. This variation likely stems from environmental, genetic, and lifestyle factors, as well as cultural differences in reporting ED. The researchers identified significant risk factors for ED, including age, obesity, diabetes, depression, heavy alcohol use, and smoking. Now on to the big question, is there a link between ED and cardiovascular disease? The answer is a resounding yes. The researchers found a wealth of evidence linking ED with conditions like heart attacks, hypertension, and strokes. They also found that men with ED had an increased risk of all-cause mortality and cardiovascular disease mortality. However, most of these studies were cross-sectional, meaning they only looked at participants at one point in time. So it's tough to say whether cardiovascular disease causes ED or vice versa. In conclusion, the global prevalence of ED is high, and it significantly impacts the quality of life for men and their partners. Doctors should consider screening for ED in at-risk patients, as this information is often not volunteered. So there you have it, folks. ED is more common than you might think and linked to serious health risks. If you found this video helpful, don't forget to like, subscribe, and hit that notification bell. Stay healthy, and I'll see you in the next video.